Thank you, Mr. President. I'm going to speak about hydroxychloroquine and the efforts around that. Just to preface, I'd like to echo what the President said about the American people and the resiliency and the just terrific work. Mitigation is such an important part of our fight against the COVID-19 virus. Last week, as the President said, we issued an emergency use authorization to allow the donated hydroxychloroquine to come into the country and enter the general circulation. We are prioritizing this drug to come in for clinical trials, also into general use for physicians, because as you know, physicians, based upon their interaction with the patients, their assessment of the risks and benefits, can write a prescription for hydroxychloroquine if they think it's appropriate for the patient. Being a physician, we do this all the time, and that assessment needs to be done between a patient and a doctor. And then the third portion is we wanted to make sure that these drugs were in the circulation, in the supply chain, so that people who have them or need them for the other indications, lupus, rheumatoid arthritis, had them available. So that was the purpose of the emergency use authorization. One other thing I'd like to mention is that we on Friday stood up a formal convalescent plasma program. We have a great deal of enthusiasm for that. There are some reports that this is of benefit to patients in other countries who have had the COVID-19 virus. And what this means is taking plasma from patients who've had the virus and who have recovered and transferring the immunity, the immunoglobulins, if you will, the immunity from that person to someone who's sick. And we're hopefully expanding that across the country. The Red Cross is involved in that program, and I think it shows a great promise. It needs to be studied like other things, but just like I said before, it provides hope. We don't want to provide false hope, but definitely hope. Thank you.
Thank you very much, Mr. President. I'd like to just take a couple of moments to talk a little bit about the public health aspects and how it relates to what the President just said about the need for us to begin to at least think about returning to some degree of normality. And that has to do with what's going to be happening as we end this week and we go into next week. You will be seeing, and we should not be surprised because the kinetics of how this virus works is that we're going to be seeing that there are going to be deaths that are going to continue to go up. But as I mentioned to this group and to the general public multiple times, there really is a cascading of events where you have new cases, hospitalizations, intensive care, and deaths. So at the same time that we may be seeing an increase in deaths, we want to focus on the effective mitigation is really the number of new cases. And that's what we're going to be thinking about and looking about. So we're going to pay close attention to that, and hopefully the kinds of mitigations that we're talking about are going to have the impact to allow us to begin to think about maybe changing a bit. So the question arises is the mitigation working? So let's look historically and then just look at the reality of it. Clearly in the countries, China included, that have implemented since very strict kinds of programs of mitigation, clearly it works. In our own country, we've seen indication of that in Washington. Remember, Washington State was the first to get hit, but they put in a really good program of mitigation. And if you look at the charts that Dr. Berg showed the other day, they're still down there doing well. And the reason is, again, what I've said before, but I think it's worth reiterating, that we have two opposing forces here. The virus, which wants to do what the virus wants to do. Viruses transmit from people to people. When people are separated from each other, virus does not transmit. It doesn't go anywhere. And that's the reason why something as simple as the physical separations, because if you look at the Vice President's chart that he shows all the time here from this podium, every aspect of that ending the COVID outbreak in 30 days has some aspect of it of physical separation, whether that's avoiding crowds, whether that's staying 6 feet away from people, whether that's doing teleworking, all of it does that. That's our most important tool. We'll be talking about vaccines and drugs and things like that that will mitigate later. But this is what we really have to do. And I want to actually just plead, as I do multiple times from here, to the American public. You know, as sobering and as difficult as this is, what we are doing is making a difference. So we really need to continue to do that. I must tell you, I was just mentioning to the Vice President as we came in, last night when I wasn't here, I went out with my wife and actually did a little power walking down Massachusetts Avenue. For those who live in Washington know what I'm talking about. And we passed a couple of restaurants where people were getting takeout food. The restaurants were closed to people going in, but they were open to takeout. And I saw something that absolutely made me feel really, really good. They were separating themselves by at least 6 feet. In fact, some of the restaurants had little things on the floor that said, stand here and then stand there. And I think if we as a nation pull together to do that, hopefully when we keep coming back here at these press conferences, we'll be able to show you that that curve that we keep talking about is going in the right direction. And I'd be happy to answer questions later. Thank you.
On the reproductive value of the virus, the WHO had it at, I think, 2 to 2.6. Others had it a percentage point or two higher. Do we have a new number now based on those mitigation techniques? Have we managed to bring it down?
You know, it's an excellent question, and it's why all of the modelers, and I really want to thank them again, they're reevaluating all of their models in light of the level of the impact of the mitigation. Remember, none of us had really been through this before. So when we modeled school closures and distancing and staying at home and all of these pieces, that had never really come into the model before. They're working on that very diligently now. Of course, just to be clear, we won't know how valid the models are until we move all the way through the epidemic. What we're triangulating right now, and instead of working on R naught, we're looking at testing and triangulating testing, test positive cases, hospitalizations, ICUs, and the whole, and of course, the recoveries, because that's also very important to us. I think it's very important that the American people know that there are equal number of states with less than 5% positives despite high levels of testing. So there are states that are mitigating and making this work. There are also the states that you know of, the 18 states that have the larger outbreaks, and we're watching them very carefully, triangulating for them all of the information to ensure that clients who come to the hospital are cared for. And then there's states in the middle that we're trying to figure out, are they changing or not? Each of those states and each of those epidemics within those states may have a different R value. And that is what we're trying to figure out, and it's very variable on each of these factors. But the bottom line is, and I think going into this weekend, it's really important for the American people to know this, Spain and Italy are moving through this. They are seeing their number of cases drop. They're seeing the number of people in hospitals drop. We are about, on our models and on the actual data, about 12 days behind them. At the same time, we see in the United States really good case studies of the impact at Washington State, of California, and then a series of smaller states where we're trying to learn from them how to do surveillance. And with these new HHS, Abbott ID Now kits, and I just want to thank Admiral Girard for getting them out, being able to look at testing in a more comprehensive way so we can be doing surveillance and mitigation simultaneously so we can answer that very question. It's going to be very difficult to answer at this moment across the United States because each metro cluster is on a different pathway as they move through the epidemic. And I think we just really ought to emphasize through, because we see Italy, we see Spain moving through, and we hope to be in that same position. At the same time, as the president said, he's concerned about every single person that is succumbing to this virus. We all are. And that's why we're making sure that in this triangulation, they're tracking minute by minute. When we say FEMA and HHS is tracking minute by minute the ventilator, hospital, and ICU bed need, that's exactly what's happening. And also being flexible and responsive. To have DOD take 1,000 healthcare providers out of their medical corps is a very big deal. I was in the medical corps for 29 years. We never did that. So this is saying we respect and understand the importance and value of the American lives and doing that. But the R values will be variable by state.
And China has warned of a resurgence of the virus. Has the U.S. developed a plan if, in fact, a second wave of the virus does, in fact, occur here in the country?
Yes, we do. I mean, one of the things that obviously is parallel we're thinking about the possibility, as I mentioned a little while ago, about mitigation allowing us to turn the corner, very much on the front burner is what happens when we do, because the risk of there being a resurgence is real. So what we need to do, and I believe I said this before, but it's worth repeating, that what we need to have in place, and we will have that in place, is that as you then pull back, you have to have the capability of, in a very pristine, precise way, do the kind of containment when you do see it. Because remember, when you get to mitigation, containment takes the back seat because you're just struggling to mitigate. But when you get it down, you need to make sure it doesn't resurge. So that will require the ability to test, to identify, to isolate, and to do contact tracing. That's what we have to have in place, and hopefully we will at the time that we then pull back.
Question for Dr. Hunt from the FDA. You mentioned the plasma, sir. So this plasma that people that were infected that have now either recovered or they're doing well enough, and then they're transferring it to, is it family members? Can you walk us through that's working, and is it kind of like a case-by-case basis in certain hospitals? What are the results from that? I just was not familiar with that.
So this is a situation where someone who's recovered from the virus, doesn't have the virus in their system at all, you can take plasma, and this is a pretty routine procedure. You can actually donate a couple times a week, a couple times a month, frankly, and give that plasma. That plasma contains the proteins in the blood that have the antibodies against the virus. You can take that, process it, and then give it to someone who's ill. And so that allows you to transfer that immunity. It doesn't have to be matched by family or anything like that. Since last Tuesday, the Tuesday before last, we've allowed academic centers and other laboratories and hospitals around the country to do this on a compassionate use basis. What we did was we pulled this together in what's called an expanded access program and run it through the Red Cross because they've got the greatest system and capacity for doing this. And this allows us to scale up so that when people get sick, we can actually have these donated plasma packs given to the patients who are sick.
So do people need to be donating plasma now? So obviously some of us don't know if we've had it and recovered. What should people be doing?
So we've started with the Red Cross in this program. We made an announcement yesterday. We are planning to actually scale that up, and we'll have more information this week because we want to make sure we have the systems in place. It's a superb question.
I was wondering about what you're seeing as far as lupus patients in regards to coronavirus. I know the president mentioned this earlier, but what does the medicine say?
What is the question? Is that what is the incidence of coronavirus?
If you have lupus, do you have a greater chance of getting coronavirus?
There's right now, this is being looked at in a natural history study. We don't have any definitive information to be able to make any comment on that. It's an obvious good question because it might be a way for us to get some interesting and potentially important data as to the role of those medications. But that's something that is now being looked at, but we don't have any data to be able to say anything definitive. I'm glad you brought up that question because I don't think people can really fully appreciate the extraordinary effort of these people. I mean, it's amazing. I did all of my medical training in New York City in a big, busy New York City hospital at a time when it was just what you normally see in a hospital. I came to NIH and I spent about 5 to 8 years in the very early years of the AIDS epidemic, which was just the darkest years of my life because almost every single one of my patients died. And yet, as we knew epidemiologically, that there was very little risk. There was a small risk, but very little risk of getting infected from a patient. To see now what these brave warriors are doing in the hospitals, not only giving life-saving treatment to people, but every single day putting themselves at risk for themselves and their family. I just think that the American public owe a phenomenal debt of gratitude for these people.
How do you want me to show that?
And they should just salute them at every ways you can. You know, when we were at war and at the height of the war in Afghanistan and Iraq, when you're at an airport and you'd see somebody with a uniform come by, everybody would do that. I think that's what we should do when we see healthcare workers, just applaud them.
To what extent do you think that you can use antibody tests to determine who can go back to work and how?
We think it'll be a tool to help us get people back to work. It'll be additional information because, as you know, if you have an antibody, that means you were exposed and have recovered from it. That, with the information about diagnosis, should help.
But how quickly can you scale up this testing to determine on a large scale how many people can go back to work and have these antibodies?
So as you know, a couple weeks ago, we provided a great deal of regulatory flexibility around this. A lot of great developers have been working on this. Dr. Burks put a call out to the academic labs around the country to do this, and we've been working very closely with a number of manufacturers. So we think that it can be scaled up relatively quickly.
In a recent interview, you had said that you knew the 15-day guidance would not be enough. I wanted to ask your confidence level about the 30-day guidance and whether it'll be enough.
You know, it's tough to talk about levels of confidence, but I can tell you one thing that I feel strongly, that if we do in a very proactive way what I said in my opening comments, and people literally across the country as a baseline have that physical separation, and as we've mentioned up here, there'll be varying degrees of that depending upon whether you're in New York City or you're in a place that's less. But every place, everybody should be doing some degree of this physical separation. If we do that, again, I have confidence that what we will see is the turning around of the curve. Whether or not it'll be all the way down where we want, it's impossible to say. I would be foolish to say that. But the one thing I am confident in, so let's take this to the bank, that mitigation works. So it does. We've seen it in other countries. We've seen it in our own country. And that's the reason why I keep coming up at every chance I get to plead with the American people to please take a look at those guidelines that the Vice President keeps putting up with his chart. Because every single one of those points has something to do with physical separation.
And how many deaths exactly are you expecting?
So as you can look in the places that are the most difficult hit right now, the Detroit area, the New York area, the Louisiana area, and we are doing it by the counties in those states because there are, mostly it's metro areas and the bedroom communities around those metro areas because people went to work and got exposed and came home and exposed other. If you look out in New York now, you see that it's in Long Island and it's out in Suffolk County and Nassau County. All of those counties, Wayne and Oakland, they're all on the upside of their curve of mortality. So you know when you get to the peak, you come down the other side.
And when will that peak be?
So by the predictions that are in that healthdata.org, they're predicting in those 3 hotspots, all of them hitting together in the next 6 to 7 days.
Are you thinking tens of thousands of deaths in that period of time?
You can go to the website. It's variable. Each one of those communities is different, but you know where New York is, how much their mortality has been, and you know what we're seeing today are the people who were infected 2 or 3 weeks ago. If mitigation in New York worked, and we believe it is working, the cases are going to start to go down, but the mortality will be a lag behind that because of the comorbidities and other conditions. So that's why all of the predictions are that this next week, and I think we said this last Sunday when we talked about the charts, and it's difficult to do. And we tried to prepare the American people to understand that you have to, as much as you go up, you have to come down the other side because coming down is a reflection of the cases that were coming in before.
Would you rather not say a number?
I'd rather not say a number, but the numbers are available if you go to the website. I mean, you can see that there's several hundreds per day in New York. And I think Governor Cuomo has talked about that increasing still into the 500, 600, 700 range a day. So, you know, that's very concerning to us. We, again, applaud the healthcare workers who are doing every single thing humanly possible to save more lives. And we are ensuring on a ventilator by ventilator, day by day, to get them there so that we can say and we can be there when they need it. Because we are supposed to be that group that comes in after all of the resources are exhausted. And we really applaud what Oregon did. And we really applaud what the governor is doing about moving between the states, between the different counties to bring them to New York. Because that's what's needed today. A different place will be needed tomorrow.
You You mentioned, just to follow up on something apparently you said yesterday, that you had some concerns about Pennsylvania, Colorado, and Washington, D.C. Could you expand on that?
We're watching them because they are starting to go on that upside of the curve. We're hoping and believing that if people mitigate strongly, the work that they did over the last 2 weeks will blunt that curve, and they won't have the same upward slope and peak that New York, New Jersey, Connecticut, and part of Rhode Island are having. So this is a very important, the next 2 weeks are extraordinarily important, and that's why I think you've heard from Dr. Fauci, from myself, from the president and the vice president, that this is the moment to do everything that you can on the presidential guidelines. This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe. And that means everybody doing the 6 feet distancing, washing your hands.
So, I mean, ditto to everything that Dr. Berg said, but also to emphasize why it's so important to do that, because we're looking at 3 or 4 really key hotspots that are still going up. It's absolutely essential that the ones that are down at that lower level that Dr. Berg showed the other day, those communities where they're still going up, we've got to make sure we don't have multiple waves of peaks. That's going to be the answer to the question of when we can start pulling back. Because if you keep having multiple peaks and different waves, that's going to make it very difficult. We put your foot on the, exactly what I said just before, and I keep repeating. Just make sure everybody does at least the minimal amount of that physical separation. Because the virus has no place to go if you're physically separated.